Hereditary angioedema, HAE, is a debilitating and potentially life-threatening genetic disease, characterized by unpredictable recurring swelling attacks called edemas in the hands, feet, face, larynx, and abdomen. Some patients suffer an attack almost weekly, others only a few times a year. During an HAE attack, edemas may occur both externally and also internally. On the face, as well as on the hands and feet, edemas are primarily of a disfiguring nature, and the magnitude of swelling may impede daily activities. In the intestinal area, they trigger colicky painful cramps, and in the laryngeal area, they may even lead to death by suffocation. Patients suffering a cutaneous attack may remain housebound and miss work or school, while abdominal or laryngeal attacks will almost always require treatment at hospital. HAE attacks may be triggered by different stimuli. Bradykinin, a physiologically active small peptide, plays a key role in edema formation. A genetically caused lack of C1 esterase inhibitor leads to an imbalance in the edema formation cascade. A swelling is finally triggered by elevated bradykinin levels produced locally. Firazyr, also known by its generic name icatibant, is a potent and specific peptomimetic bradykinin B2 receptor antagonist that has been approved for the treatment of acute HAE attacks. Firazyr specifically intervenes with the edema formation cascade at the crucial bradykinin level in order to block acute edemas, thereby preventing further swelling. Let's take a look at what happens during swelling on a cellular level. Under normal circumstances, blood cells and plasma flow through the veins and fluid does not pass into the surrounding tissues. The equilibrium of stream in and stream out is maintained by the endothelium. However, this is susceptible to disruption during an HAE attack. Initially, there's a marked increase in local bradykinin concentration. Bradykinin, reaching its receptor, inserted into the membrane of the endothelial cells, forms a loose bond with it and thus triggers receptor activation. The consequence of multiple receptor activation is that the tight bonds between the endothelial cells loosen, allowing plasma content to pass into the surrounding tissue. The barrier function of the endothelial cells is neutralized, and a swelling attack is initiated. Due to its effective action, Firazyr is the first and only self-administered subcutaneous medication for the treatment of acute swelling attacks in HAE patients. Firazyr can stop further progression of existing or formation of new edemas and leads to the rapid relief of swelling in all kinds of HAE attacks. The molecular structure of Firazyr is very similar to that of natural bradykinin. The active agent binds specifically to the bradykinin receptor and blocks receptor activation by the endogenous ligand bradykinin. Firazyr has been tested in a multinational pivotal registration study program, and since July 2008 has been approved in the EU for the symptomatic treatment of acute HAE attacks in adults with C1 esterase inhibitor deficiency. Firazyr may also be self-administered or administered by a caregiver after training in subcutaneous injection technique by a healthcare professional. Firazyr comes in a 3 ml pre-filled syringe and is administered subcutaneously. It has been shown to have a favorable safety profile and was well tolerated in more than 1,300 individuals in clinical studies. Shortly after injection, Firazyr molecules reach the site of blood vessel leakage. Here they compete with bradykinin for binding to the receptors and start blocking further receptor activation. Diminished receptor activation eventually causes the endothelial cell layer to close together again, thereby halting the uncontrolled flow of fluid into the tissue. Following administration of Firazyr, the edema formation cascade is effectively interrupted. Speed of action and start of symptom relief is the essence for all patients experiencing an HAE attack, even more so for those experiencing an attack in the upper airways.